all of us are being influenced by smell all the time, whether we recognize it or not. There's an invisible universe at the tip of our nose, and it impacts on every single thing we do. Smell is actually part of the limbic system, or the emotional brain. So the quickest way to change somebody's mood state or behavior is with smell. So, and through a variety of different ways, we've been able to demonstrate that smells can actually affect people's mood state or behavior. Through something called contingent negative variation, you can actually show changes in blood pressure in response to different odors. And you can actually even show changes in EEG or brainwave response to different smells. One of the things that we did is we looked at the effects of odors on perception of room size. And we put people in little coffin-like tubes, and we found when you infuse the smell of green apple and cucumber, it makes people perceive the room as larger. Whereas if you infuse the smell of barbecued roasting meat, it makes people perceive the room as smaller. So what we did is we looked at effects of odors on ambient odors on objects. And in this study, what we did is look at the effects of odors on people's perception of Nike shoes. And what we did is we took two different identical rooms, and in each room we had an identical pair of Nike shoes. In one room we put a filtered air, and the other room we had mixed floral odor, which had the greatest effect on medical students' brainwave frequency, and looked at the impact. And we found in the presence of mixed floral smell, 84% of the subjects said they liked the shoes more. Not only did they like them more, they said they would spend more money on them, an average of $10.33 more per pair of shoes. We've done we know that bad odors have a variety of different effects. We've done a whole series of studies looking at bad odors, and for instance, bad odors tend to cause people to be more aggressive. If in a paradigm where a college male is told by turning a knob to the right, a colleague gets an electric shock. In the presence of bad odor, they turn the knob much further to the right. Or on days when there's bad smell and air pollution, there's no more motor vehicle accidents, suggesting drivers are driving more aggressively. For the Attorney General's office here in the state of Illinois, we studied a mulching site south of Chicago. On days when the bad smell would waft across the street to the school, there's an increase in behavioral problems in school kids. So what that suggests is that bad smells tend to increase aggression. As a matter of fact, just recently for ACTS, we looked at a bar here in Chicago, and we found that there's a whole host of different bad smells present, and this miasma is coming from the patrons more than anything else, because in Chicago, when they got rid of indoor cigarette smoking, people's individual odor comes out more. And realize you are as you smell. If you smell good, people perceive you're good. If you smell bad, people perceive you're bad. And so your inner self is to be represented based on smell. Well, let me tell you about something we've been doing over the last few decades, and that is we've been looking at smell and impact of smell and taste on appetite. The reason is because, as it says here, don't spoil your dinner. And one of the things we found that after people lost their sense of smell from head trauma or whatever, they initially would gain 10 or 20 pounds. So I figured, gee, if you lose your sense of smell and you gain weight, maybe if we gave people extra smell, they would lose weight. And so we gave it a try, and it says, for dessert, I'd like to smell some chocolate cake. The part of the brain that we think smells of the olfactory bulb at the top of the nose is directly connected to the satiety center in the brain, the ventral medial nucleus of the hypothalamus. That's the area, if you destroy it in a guinea pig, the guinea pig will eat and eat and eat until it dies. And if you think about it for a second, why is it that you stop eating when you're full? It's not because your stomach is full. That only happens when you've overeaten at Christmas and Thanksgiving and the like. And it's not because your blood sugar changes, because unless you have diabetes or reactive hypoglycemia, your blood sugar before you eat and after you eat is the same. The reason you feel full is your brain interprets the amount of food that's going through your mouth and the amount you've smelled to mean I've smelled it, therefore I've eaten it, hence I better stop eating it, I've overeaten. So what we did is we did a series of experiments. And initially, what we did is we took medical students, and we gave them all Hershey bars. We told them, whenever you feel like eating, take these Hershey bars out, sniff them 10 times, and put them back in your desk drawer. Well, what we found was at the end of the day, there were no more Hershey bars left. The medical students had eaten them all. So we learned two things with that. Number one is you can't trust medical students. And number two is there's this direct Pavlovian conditioned response where you smell a smell, and you gobble it down real fast without even thinking. So what we did is we put the odors in little plastic tubes, and we had people inhale the tubes. And we did what's called a double-blind crossover trial of 105 people, 2 weeks on active odor and 2 weeks on placebo. At any rate, people lost an average of 1.5 pounds in 2 weeks. We subdivided into those who had a normal sense of smell. They lost an average of 2.78 pounds. When we further subdivided it into those who had positive hedonics, who liked the smell, they lost an average of over 3 pounds in a 2-week period. So it suggests that maybe odors might help people lose weight. So we then did a larger study of 3,193 people, and we had them smell different odors like banana and green apple and peppermint. And people lost weight in the average of a little over 30 pounds in 6 months. But we had problems with that. People were shoving the tube in their nose, getting nosebleeds. We had these tubes filled with these powders, and we had the police calling us because these people were sniffing these powders under the desks at work. So we had all this dilemma. So we ended up coming up with these different sprinkles that people sprinkle onto their food, and they sprinkle it. And we've now done a whole series of studies, and people lose about 30 pounds in a course of 6 months with this. Well, I want to just bring up a whole other issue. We were called by the oncology floor at the hospital because patients with cancer, they lose weight, or in chemotherapy lose weight, and they say, well, how can we cause them to gain weight? And they develop difficulties with smell and taste. And what we do is to cause them to gain weight, we serve them diet soda along with their meal. And I'll tell you why. Diet soda tastes sweet, okay? And so the brain says sugar coming in, and it causes a cephalopancreatic reflex, causing the brain to tell the pancreas sugar coming in. In response to dropping sugar, pancreas releases insulin. In response to dropping insulin, increasing insulin, blood sugar drops, and as a result, people eat more. So the way you cause people to gain weight is you add artificial sweetener to their meals, and the way we do it in rats to cause them to gain weight is we add artificial sweetener to the rat chow. So if you want to gain weight, what you want to do is drink diet soda along with your meals. Let's talk a little bit about this. We've looked at effects of odors and sexual arousal for a while, and the reason is we found that about 17% of people who lost the sense of smell developed sexual dysfunction. So the idea came up that maybe there's some relationship between odors and sexual arousal. As it says here, hold it right there, young lady. Before you go out, you take off some of that makeup and wash off that gallon of pheromones. So the idea is that maybe humans have pheromones. We don't know. It's something that we've been looking at, but even more than that, we decided, well, let's look at how odors can impact upon sexual arousal. So what we did is we measured penile blood flow. We took volunteer medical students, put on surgical masks, impregnated surgical masks with different odors, and we tested the odors and measured penile blood flow. And we tested all sorts of floral smells and perfumes. As a control, we threw in the smell of baked cinnamon buns. And lo and behold, the baked cinnamon buns had a greater effect than all the perfumes put together. So, I wasn't sure what to make of that. It could just mean the medical students are always hungry. You don't know in that group. So we then studied males in the general population here in Chicago, ages 18 to 64. And I went on loop radio and requested volunteers, a very unusual group. But I've never seen so much general jewelry in my life. Anyway, what we found was that we measured all sorts of floral smells and perfumes and a whole bunch more food items. And what we found is the number one odor that enhanced penile blood flow. Any guesses? So, well, okay. The number one was it turned out to be a combination of lavender and pumpkin pie. Number two is a combination of donuts and black licorice, and number three was a combination of pumpkin pie and donuts. And although there was individual variation, so the older the man, the greater the engorgement with vanilla. Those who were most sexually satisfied had the greatest increase with strawberry, and those with the most frequent sexual intercourse had the greatest increase with lavender, oriental spice, and cola. And to give you an idea what sort of changes those were, perfumes increased penile blood flow by a median of 3% compared to 5% for cheese pizza, 9% for buttered popcorn, and 40% for lavender and pumpkin pie. Well, we did this study, and Jay Leno said to me, well, Dr. Hirsch, I don't really care what arouses men, what arouses women. So I said, well, I don't know. So we did the homologous study looking at vaginal blood flow, and we found that the number one odor that enhanced female sexual arousal was a combination of Good and Plenty and cucumber, although Good and Plenty and banana nut bread also had very positive effects. But we found differences between men and women. In men, every single odor we tested enhanced penile blood flow. That wasn't the case with women. With women, some odors acted to inhibit sexual arousal. For instance, the smell of cherries, the smell of barbecued roasted meat, and the smell of men's cologne all acted to inhibit female sexual arousal. So I guess the take-home point is that men, if their aim is to wear cologne to induce sexual arousal, throw away the cologne and go get some Good and Plenty. Well, I wanted to tell you about this for a second. Rusty makes a movement, dog breath. We did this study for Cosmo. Actually, what we looked at is they want to know what people's kiss preferred. What was the preferred taste of the person's kiss? So we looked at 100 married women, 100 single women, 100 married men, 100 single men from Chicago and the suburbs. We found that married women and single women preferred their husbands or their date's kiss to taste fresh, clean like toothpaste. Single married men preferred the wife's kiss to taste like spearmint or peppermint. Single men preferred their date's kiss to taste like alcohol. What happens? We were studying sexual arousal and what happens when you're sexually aroused. Okay? Well, what happens when you're sexually aroused? You see engorgement of the erectile tissue in the nose. And what happens is the erectile tissue engorges, and it engorges, it causes internal expansion, and it causes eddy currents to develop in your nose, so your sense of smell improves, and that's why you breathe through your mouth when you're sexually aroused. So we began to explore what else causes the same nasal engorgement. And that's where we came upon lying. Because when you lie, you feel guilty about it. There's a sympathetic nervous system response, a flight or fight response, and it increases your blood pressure, increases and pulse, which your lie detector measures, and increases the blood flow in the nose. It causes this internal engorgement, which causes mast cells to degranulate, release histamine, which causes your nose to itch. So you tend to touch your nose or scratch your nose more when you lie. And we named that the Pinocchio effect. And so we began to explore other aspects of indicators of lying, and we ended up going through psychiatric literature, and we found 32 indicators of lying. Things like, the liar's lean, where you tend to lean forward when you lie. Or there's something called expansion of contractions. When you tell the truth, you tend to use the contraction, would and could and didn't. And when you lie, you tend to use expansion, would not, could not, did not. And so we wrote up a paper on this, and as a case example for it, we looked at President Clinton's grand jury testimony. And what we did is, and we found that on 29 of the things, he was markedly positive indicator of lying, as indication of lying. And so we did this when he was still president, and we wrote it up and presented it at the American Psychiatric Association meeting that was being held in Washington. And I flew out that morning, and the front page of the USA Today was a story about our study, and it said, and the last line of the article said, official White House spokesman states no comment. So I knew there might be some problems. So we presented it, and in half the screen we had President Clinton saying, touching his nose, leaning forward and said, I did not have sex with that woman. And then the other half of the screen we had O.J. Simpson in his post-release BBC interview, where he was asked if he knew he'd killed his ex-wife. He touched his nose, leaned forward and said, no, I do not. Okay, so we presented the data, and then afterwards somebody came to the dais and said, well, the White House wants to meet with you. And I said, oh, okay. And I met with the Undersecretary of Press in a very small room, and he said, oh, Dr. Hirsch, how are you? And how's that NIH grant going? I said, oh, good, thank you. And he said, what, can you tell us about the study? Although I think he already knew about it, so I told him about the study. He said, well, we saw you on CNN this morning. Now, to give you an example, on CNN, they asked me what was the potential meaning of this. I said, I don't know. But when I was watching President Clinton give his speech in Hollywood, press conference in Hollywood, he was asked about if he had an intention of committing troops to Kosovo, and he touched his nose, leaned forward, and said, no, I do not. I said, you can interpret that however you want. That's what I said on CNN. And so the press secretary said, we think it's inappropriate for you to comment on current public policy, and here's a limousine to the airport. So I said, okay. I think that probably wasn't the time for me to ask for a tour to the White House, but listen, I want to tell you, it's been a pleasure talking to all of you, and thank you very much for having me here today.